she's gonna push. And when the baby's head comes out, it naturally turns to the right or the left. Okay? At this point, tell her to stop pushing. Check real quick, make sure there's no cord around the neck. If we do find it, we're gonna loop it around and get it around the neck to deliver. Okay? At this point, we'll just wipe that face, nose and mouth, removing any mucus, blood, and such away from the face. And whenever you're ready, Mom, go ahead and push. She'll go ahead and push. We're gonna kind of hold the baby, kind of guide it up and down, and as the baby comes out, we're just gonna place it right here on the belly. Okay. Up on its side, flicking the feet. Somebody should take note of time of birth. We should see some response in how long?
10 to 15.
Okay. No more than 30 seconds, right? So 15 to 30 seconds, we should see some. So flicking the feet, they hate that. Flick the feet, get them pissed off, rub them, get them screaming. We like that. Okay. So during this time, we can go ahead and we're gonna monitor. And in exactly 60 seconds, we'll take our first APGAR. Looking at the baby, I'll have an APGAR for you guys. Here it's laminated. I'm one of those people, I'm not electronics, I love paper. It never disappears when I need it most. So I have these laminated in my jump kits, so if I need these, I can pull them out. But we'll go through the APGAR. So we'll say we have a nice perfect 10, it's all nice and pink, has a good heart rate, 130, we're happy with that. Good activity, good respiratory, good cry, so APGAR is good. Mom, at this point, she can go ahead, hold the baby, she can start nursing the baby. Remember, nature gave him a long leash because she was supposed to be able to grab the baby and pull it right up to her breast. So she can go ahead and hold the baby, bond with the baby. We can go ahead and cover her and Mom, give them a little bit of privacy, but just monitor closely. And in 5 minutes, we'll take a second APGAR. Is baby getting worse, staying the same, or improving if they had a bad APGAR? And then, once we get into that, 5 minutes has gone by, we check. This goes from clear to kind of an opaque color. You'll notice there's no longer pulsating. So we're gonna go ahead and clamp and cut. Measurement, my favorite, I'm a visual person. Hang 10, everybody does a hang 10, thumb to pinky. That's all the distance you need to give it. That way, why do we leave that distance?
Don't get anywhere near the baby.
Actually, the reason we're doing this, they don't do it in the hospital, they clip them real close. What we're doing is we're leaving an emergency IV port. So if the medics or someone needs to do anything, this is an emergency IV port. And with IVs, or anytime they do that, they always work distal to proximal. So as it blows, they can work up the vein, so artery from here. There's 2 arteries in a vein. So again, you won't see it and you won't feel it pulsating. So we'll go ahead and measure, clamp, 4 fingers apart, clamp. Doesn't matter the size of your hand, but that's just a good distance. We'll cut between, and baby will be free. She can continue to nurse. Placenta will expel. That goes in its own separate bag. And that's where the fundal massage comes in. We'll get into that with that big boggy uterus. Someone's gonna knead it like dough, and we're gonna knead it until it comes to that firm, soft ball. Female sanitary napkin,